We all know minors cannot purchase cigarettes, consume alcohol, or gamble until they become legal adults at the age of 18. All three have harmful lifelong effects to which minors cannot meaningfully give consent. But the LGBT lobby is more than okay with grooming children in the direction of chemically and surgically altering their bodies to superficially appear more like the opposite sex. Now, thankfully, some states are stepping up and saying no to this gender transition procedures, these procedures that have lifelong implications for children who cannot legally consent. These laws, sometimes called Save Adolescents from Experimentation Acts or SAFE Acts, protect children from having irreversible harm done to their bodies. Joining me now to discuss this is FRC's Dr. Jennifer Bauwens. She's the director of FRC's Center for Family Studies. Jennifer, welcome back to the program.
Thanks, Tony. It's good to be here.
All right. You are a licensed therapist, clinical researcher, and I was just talking with the Attorney General of Missouri about what's happening there in St. Louis, how these parents are being coerced into their children moving through this process of same-sex hormones, puberty blockers. And we were discussing the question as why? Why is this treated differently? And your testimony before the Nebraska legislature recently brought that point forward that we're treating this differently than anything else. Tell us how, and then tell us why.
Yeah, well, there are a couple things that are going on here. And one, if we look at the bigger picture, is that we have clinical licensing boards, codes of ethics for the profession, counseling bans. All of these things create a lot of pressure on those who are in the field as therapists. For those of us who don't believe that these procedures are the best treatment, there's pressure on us to conform because our code says it. Maybe we live in a state that bans us to do any kind of exploration. If a child comes in and says, I have gender dysphoria or I'm transgender.
So they're restricting you from even having the conversation.
That's right. So they're restricting normal, good treatment.
What else do they do that for?
Well, I think what's happened is that this issue has become a human rights issue. So once you elevate it to a human rights issue, you can throw out the science and you can attack your opponents as bigoted, racist, etc. And you're not going to look at the true issues.
But it's not a human rights issue.
That's right. It's not a human rights issue. And so
what kind of issue is it?
It's a mental health issue. It's a spiritual issue. It's an ideological issue with a lot of money backed behind these issues.
So what is the motivation? Is it the money? Is it a profit motive? Or is it a blind allegiance to an ideology?
I think it's all of the above. The answer is D.
Okay.
All of the above. You certainly have some key money backers, that are funding this ideology. But then you have those who just believe in it, hook, line, and sinker. And some of those folks, they're going to advocate for this no matter what you say. Because anyone who actually looks at the science, they start backing away from it if they have an open mind to
the science is clear?
The science is very clear. Look, every country that actually assesses the research with any kind of critical eye, they start backing away from it. Florida did the same thing.
When you look at this, it's inexplicable how we're advancing this without looking at the science or asking legitimate questions that we would ask on other topics.
Yeah.
You mentioned the spiritual. Is there a spiritual element to this, a driving of a darkness to lock our children into a very destructive and dangerous path?
Absolutely. Because what this does is it promotes a type of fracturing of the mind and spirit. So if you can fracture someone's mind so much that they don't know who they are, they're disconnected, almost like the Gnostics back in the biblical days where they were disconnected from the body and the soul, or they believed in that kind of disconnection. You can control someone a lot easier when they need mental health and spiritual help.
And that makes it difficult to find truth.
And it makes it difficult to connect with the triune being who is complete together, Father, Son, and Holy Spirit. And we, as spirit, soul, and body, are like that triune
Right.
being. And so I believe the enemy of our soul is trying to fracture that so that we don't even connect in who we're supposed to represent and reflect.
So a conspiracy aimed at our children driven by the spiritual forces of darkness.
Absolutely. Absolutely. And so when we're fighting this, we're not fighting flesh and blood. We are in a spiritual war. And the good news is that we're seeing movement.
We
on
are.
our
A
side.
lot of movement across states. People are seeing this. But for parents that find themselves, grandparents find themselves in this situation, they have to recognize the spiritual side of this and begin to pray and seek that spiritual guidance as well.
Yeah, absolutely. We can't separate. Just like we're talking about all this separation, we can't separate the spiritual aspect of this
Yeah.
from the physical obedience of standing up and saying something.
Well, Dr. Bauwens, that music means we're out of time. I hate that because it's always just fascinating to talk with you. So thanks so much for joining us today. Look forward to our next conversation.
Good to be with you.
All right.